we have a 58-year-old Caucasian male. He has a stiffness pain and burning, stabbing pain in his foot. And he's describing a pain 9 out of 10, worsening at nights, more worsening overnight. He has also had back surgery. He had his nerve conduction study, which was negative for any large fiber neuropathy. His medical history includes reflux disease, gout, back injury, and bunions. He actually had gone to another podiatrist, and they had treated him for HALLUX LIMITUS, and he had bilateral KYLECTOMIES done, which had kind of ended up leaving him more with less range of motion even, but he said it didn't help any with his nerve type pain. So he was a very frustrated guy. He's young, he's in his 50s, he's active, he works at a mechanic shop. So he was really frustrated with this. He does socially drink and hasn't really tried anything for his neuropathy. So when we did the test, his fibers actually came back, the number was over what we want. So it was well in the normal range. But what the test found is those degenerative changes. So, you can have normal nerve fibers, number of nerve fibers, but if they're degenerated, if they're swollen, they're still not conducting their sensation. And there's no way you can know that without doing the test. So again, this guy, negative EMG, negative NCV. If you did a Sims-Weinstein on him, it would be perfect. He would have no abnormalities. But then when you do the test, you see that there's actually degeneration in those epidermal nerve fibers, and you can start a treatment for him. And a very frustrated patient becomes a very happy patient, and you're their hero. So again, he had great nerve fibers. We just wanted to get the nerves healthier. So we started him on the vitamins. 1 month follow-up, he showed some improvement in symptoms. He said the stabbing has stopped, but the pain in his ball of the feet are still there. Those nerves are still bothering him. He was negative for any kind of neuroma or anything like that. He did have a higher arch. So at this point, I started him on pregabalin, 100 milligrams to take at bedtime, only for 4 weeks, just to kind of see if his pain improves. But also we made him custom orthotics to wear during the day while he's at work. So when he came back for his follow-up, he stated that he was feeling better. So he stopped taking the vitamins for a few weeks and the pain came back. So he became a believer. He got himself back on the vitamin supplements, and he has continued relief. Of course, it's not perfect, but it's tolerable. He's able to get through a work day without pain, without agony. So he only gets that mild discomfort at times. He takes the pregabalin as needed, but so long as he's wearing his orthotics and he's taking his vitamins, his symptoms are managed and he's happy.